don't want to go back to what we had. We want to go forward to something else. I would say we're kind of like a patient with cancer on the table, and we're opened up. It looks awful. We're under quarantine. People are getting sick left and right. There are no jobs. And we got to get rid of the cancer before we sew the patient back up. We can't just sew it back up and leave everything the way it was before. So I discovered the County of Muskegon back in 2014 when Way to Wellville was looking for communities that wanted some coaching to become better places. They wanted to fix some of these problems that have now been exposed so much by COVID-19 and by people's attention, by the attention paid to Breonna Taylor and the murder of George Floyd, and just, and we face, I was thinking about what to ask you guys beyond, I'd like you to introduce yourselves. And my first version of it was, how can we help more? And it's really not that. How can we remove the obstacles that are stopping you from helping yourselves? And Muskegon is 180,000 people. It has poor white people in the east. It's on the eastern shores of Lake Michigan. It has a few townships that are mostly Black and mostly poor. It has a bunch of nice, well-meaning rich people. It doesn't have much of a middle class. That kind of disappeared along with manufacturing and a lot of other industry. And Muskegon Heights was created basically by redlining and highways going through neighborhoods. So again, our goal is to be useful, but Muskegon isn't paying us. We're not paying Muskegon. We're a nonprofit. They don't need to listen to our advice. We need to make sense, or they can ignore us. And at the same time, they're not trying to tell us things are great, so we'll give them money, because that's not what we do. So who wants to go first?
Okay. Well, again, Esther, thank you for inviting me to be part of the call. And my name is Tressa Crosby. I'm a community health worker, lead here in Muskegon. I work for Mercy Health, which is our health system here in this county. I've been working in the Muskegon community for over 15 years. I've worked with child programs that address childhood lead poisoning prevention, mentoring children of prisoners, working with high-risk pregnant women, working with individuals that have chronic disease. And a lot of what we do is we address the social determinants of health. So what are those things that people need that are impacting their health? And so as Esther was talking about, what barriers could we help move out of the way to make things better? Boy, that's a big question, and I can't answer for all of Muskegon, but when I think about some of the things that have gotten into our way, it does go back to history, right? And so as she talked about the different areas of our community, we're a pretty segregated county. And so when you look at what were the policies back then that brought us to where we are right now, what we know, when you think about the social determinants of health, we know that policies and programs impact the health factors, and the health factors create the health outcomes. And so if you're living in a poor, a community that has poor substandard housing or limited access to transportation, maybe poor air or water quality, that impacts your health. If you have limited access to education or employment or income or family and social support, these are the social and the economic factors that affect your health. And then when you look at health behaviors, because you're stressed out, you're smoking, you have increased tobacco use or substance use, or you lack a proper diet and exercise. These are the things that have the greatest impact on a person's health. Many times we think that it's just the clinical care, get everybody good health insurance and get them to some good doctors. Well, what we know from the Institute of Medicine is that only 20% of clinical care has a direct impact on the population. It's really these other factors that we mentioned today, the physical environment and the social factors that impact our health as a population. And that really, for me, goes back to what has happened in history that has brought us to where we are now. And then how can we address that and start moving things out of the way? So I'll turn it over to you, Marquis.
Okay, sweet. Wow. Well, my name is Marquis Childers. I am a prosperity consultant here in Muskegon County, and I am the vice president for Neighborhood Associations of Michigan. And I also serve on a few boards for, I would say, the racial inequity and being able to provide those lenses for minorities on the board. But to address the question, what barriers get in the way of people being self-sufficient or being able to take care of themselves? What I've learned is I went out and did surveys, and Miss Tressa knows she's like the profession in the health field. So I'm more of a community organizer here in Muskegon County. And I went out, did surveys, and it's the lack of trust in systems. That is a big barrier. Also, what gets in the way is we have a lot of good-hearted people in the world that have very good intentions, and they want to offer a program for minorities, or not even just with poor people in general, whether it's white or black. But you offer the program, but once the money runs out, then the people are gone and those resources are gone. And that's been going on forever, speaking on the history piece. And it gets to a point where people are people get to a point where they don't want to ask. And once it gets to that point, you can look at the glass half empty or half full. So I kind of look at it half full, because now people want to do something about it themselves. And with that being said, it's allowing the residents to have a seat at the table, their voice to be actually not only heard, but taken in and actually being presented. It's a representation. It's not doing to, it's doing with. You want to do with the residents, because they are the professions of their life. They know what they go through. They know what they see every day. It's their reality. And it's hard to be from the outside looking in and tell someone, hey, you need this. And because none of us like that, people kind of controlling what we like and what we don't like and what we got access to. And I would say on that note, that was one of the biggest turning tables that we had here in Muskegon County, because we were able to do a Livability Lab project, which addressed the social determinants of health. And we were able to bring in the human service sector, the business sector, education, residents, and we were able to we were able to get everyone in there, even if they were professions, to look at themselves as residents, because we all are residents, no matter the profession or title we have. We all are residents. And once we were able to do that, I think we were on to a great start, and then the coronavirus kind of set us back. But what it did was it put back that it showed the forefront of what our problems is here in America. And now, instead of, like Miss Esther say, sewing it back up and not addressing the problem, now we have the opportunity to ask the question: what barriers get in your way? And once those barriers are identified, we need to remove those barriers to allow people to flourish, because economics and when you're in a impoverished neighborhood, it's hard to think for the future. You're living day to day. That's the reality of it. See, it's hard to say, what is your 5-year plan? I'm trying to get to next week. And that is the reality of it. So it's taking a step back and understanding what is going on in the day-to-day life of the regular citizen here in America as minorities, as poor white, and then we can address those barriers because we all go through similar things here in America, and we need to address the social determinants of health, or social determinants of social influencers of health. That's what I would say, social influencers of health. Maybe in Muskegon Heights, we have so many, the coronavirus, we had to sit home. So what it did was it allowed people to become innovative and start to invest in themselves. So you have more entrepreneurs, like a boiling pot of entrepreneurs here that's just itching to get to learn, to get the education so that they can take their business to the next level. And that's with technology, that's with food resources, education for the kids as far as daycare opportunities and alternative learning because of the coronavirus. It's a very family felt community in Muskegon Heights. I would say Muskegon Heights, even though we are a segregated community, I would say that Livability Lab really put people in the room for the first time ever to speak to each other. And we've been living here for generations, and that was a big thing. So I'll stop there.
So I'm sensitive. We've got the poll results. We've got, with luck, a few questions. I don't know whether I'll look at the chat for a moment, but okay, here they are. So just really briefly, Marquis, Livability Lab is very different from the thing that preceded it, which I won't mention by name, but
Yes.
was sort of a bunch of committees of the people who wanted to help. And then they would invite, Black people to come in and be Black for a while, and not much happened. And now it's very different. I'm curious, just talk very briefly. I remember you telling me that you were feeding your family much better and being more healthy. And then I'd love you to look at the results of the poll, question number 4 and question number 5. I'd love your opinions on what would actually help. I mean, right now, Muskegon is doing this on its own. I mean, there's various bits of government money, but if you were sitting here, talking to the next president, what would you, I can safely say him, what would you want him to focus on? Because I think these are some interesting suggestions. And Tressa, same question for you.
Okay. Well, I would, federal funding for public schools is and universal basic income. I think all of those are very good. I actually did the poll myself, even though I wasn't supposed to. No, I think all of those are really important because they touch on, I don't think it's one simple thing that's gonna change it. It's gonna take all of these efforts, as well as not just bringing in someone to be the token person for the Black people, because no one person speaks for all Black people, just like no one person speaks for all white people or Latinos or Asian. So I would say you would want the proper representation, and also you want to speak to the community. I would say any organization, agency, elected official, if you're going to be in the community, my suggestion is you should love the community in which you're serving and treat people like human beings, because at the end of the day, you receive that in return as being treated as a human being. So briefly, that would be mine.
Thank you. Tressa?
Yeah, thank you, Marquis. That is so, I love your vibe. I love where you're coming from and speaking from the heart. I really do. And I appreciate and respect your work. And I think I would just kind of echo what you said in terms of for folks who are interested in serving the community, but not something as here's what we're going to do to you, but here's what we would like to do with you. And so being inclusive and maybe speaking from various experiences that I've had and feeling like the token, or in our community, if you're aspiring to do anything, oftentimes you may be the only Black person that's there. So you feel kind of called out, and that's just the state of the things are in our community. So when you're looking to invite the community to the table, understand that sometimes it's difficult coming into these spaces. So if you've got people with very high income, very high education, and being a person just from the neighborhood, Jenny from the block, I'm coming to bring my experiences, but it can often feel a little overwhelming, and you could feel a little bit insecure in those spaces. So just being intentional, it comes from the heart. And I think for me, when I talk about policy and programs and getting back to that, I think about, well, what was the heart intention behind those things, right? So what was the heart intention behind redlining, right? It was not a good heart intention. It was purposeful to be divisive and to be separating. And other policies, the purpose behind it has been intentional and divisive. And then we end up with the situations that we have. We have schools that are inadequately funded. We have issues with law enforcement. So getting back to the root of things, like what are some of the root causes of why situations are, I always tend to go to look at human behavior. There's a human behind the behaviors that are happening. There's a human behind the policies and programs that were created. There's a human behind the technology that was programmed. So how are the humans of America treating each other? And that's for me, that's going to the heart of the program. So whether it's inviting someone to the table to discuss assessing our own hearts, right? That's the point of emotional intelligence. And if you come in with the right heart and you're willing to listen, I think that's where real progress happens. And as Marquis talked about the Livability Lab, it was being able to take some of those titles and hats off and just be sitting and become neighbors around the table and really talk about improving our community. And I think that's really what it takes.
So David here is asking, how has life actually changed during COVID? I mean, in some ways it's easier to go to like local meetings because you don't need to go there. You can go online. On the other hand, you may or may not have Wi-Fi. So what's the reality? I know, Marquis, you did so much work walking around the neighborhood, and now you can walk around the neighborhood and wave from the driveway, but it's getting colder.
Yeah. I would say, so what I did was, what happened, what can I say? COVID hit and everybody had to stay home order. So like Miss Esther said, there was no meetings or anything. And I would say I'm fairly young. I just had a birthday. I'm 27. So I had to go back to like, that's like old school methods to me. Picking up a phone and actually calling to check on people. Because with my neighborhood associations, we have elderly. So it was a phone call that I had to do to check up on everybody to make sure they were doing good and they were in good spirits. And after that, I kind of gave them lessons for the Zoom call, and we was able to start having Zoom meetings. So we were able to, in a sense, it's like I was able to teach people who actually taught me growing up something new. It was new for them. So I was able to teach them something I knew with technology, and now they're really good at it. On the back end on the flip side of that, school stopped. And so you had some parents who did not have access to technology to get their kids on the Zoom calls for school once school kind of picked back up. That was a big barrier there. We did have a chance to get connected with Comcast, and they were able to open up all the hotspots for us. So it was that partnership, meeting the community needs. That was actually a great thing. But again, we had jobs lost because of the furlough, and we had the layoffs. And the essential workers, the community that got impacted most, it showed with the health disparities. We lost some very key members here to our community to the coronavirus. Also, it was a lack of communication because those trusted community members were furloughed, and they were not in the loop of everything how they would usually be at each meeting and knowing exactly what's going on to get the correct information back to the community at large. So that was a big gap there. And out of that, what we did with the neighborhood associations, we created a website so it can be direct contact from those agencies to the community itself, and then those community members from the neighborhood associations can spread that information out so it can be the correct information. Because we know once the coronavirus happened, there was so many conspiracy theories going out there. We actually had people saying, no, you can't get the coronavirus, and so a week later, that whole thing shifted, and it was at first only the elderly. Now it was the young, and so knowing that was an ongoing thing, what we were able to do was provide different, I would say, I'm not sure what to call them, but they have low income people where we were able to provide them with masks, and they have pre-existing conditions, and they actually stay in these apartments and complexes. So we were able to provide them with masks, hand sanitizer, but life itself had really changed as for our norms. And what happened was everything that we suffered through before pre-coronavirus came to the light during the coronavirus, because you had no choice but to actually pay attention to the world itself. It was no more distractions, no bars, no sports. It was, you had to pay attention to the people that we live amongst. So, yeah.
So for both of you, you have Cameron, right?
Yes.
And he's what, 6 or something?
He'll be 6 in January.
Okay. And for Tressa, your kids are older, but I'm curious, what has changed in the last year or two about what you tell your kids about the future? And then we're gonna have to break off, but.
What has changed in the last year or two? What I tell my kids about the future. I think, so I have older children, young adults. My son is 23. I have a 22-year-old daughter and an 18-year-old who was a senior during COVID and getting her graduated. And then I have a 16-year-old. COVID, I guess the pandemic put us all at home together. I wasn't furloughed, but I was, we were able to work from home. And so I think we're optimistic. I guess we're optimistic. I feel grateful. My children have an opportunity to have a good education. And that is because one of the reasons is because of schools of choice. I can get to pick where my children are going, so that I feel like that they're in a safe a safe space, and not everyone has the opportunity. They may have the opportunity to choose, but they might not have the resources to get their kids back and forth. So I feel optimistic that my children have had a good education, they've graduated, and they're making choices about their own future. And my children have access because they have some resources. So that I feel optimistic about, and I can, for my own kids, for the maybe the moms that I work with. I've got moms who are living in hotels, you know, having babies in the hospital, and they have to come home to a hotel room. The struggles that they had getting back and forth to the doctor. How do I give them encouragement about the future? Like, things can get better and will get better. It's just trying to offer little glimpses of hope that you know, keep living. I can say, I speak a lot of times from my own experience in that, you know, I have been really poor. But things can get better. And today things might be looking bad, but don't give up hope. Keep moving forward. Keep moving forward. So that's how I approach today and looking forward over the next couple years.
Thank you. And Marquis, this is great.
Can you repeat the question again? Sorry.
Oh, just what are you telling Cameron? You know, like he's almost 6. You know, he's got to wear a mask. He has to do school from Access Health. You know.
Yeah, being that he's so young, it's kind of like it's fun because the big adjustment is wearing that mask, really wearing the mask, and him not being able to go to school and actually interact with kids. He doesn't like that at all, but he loves to see him on the camera and everything. And I just tell him that we're going through a new beginning. That's what I tell him. We're going through a new beginning. Sometimes the way I see it is, and I tell him this, sometimes stuff have to get destroyed to get built back the right way. It's destroy to rebuild. And the coronavirus, like I said, set us back. So we kind of sat in the house and really been able to educate him through exposing him through different things. So now I'm able to take him to meetings. He's go to school online, so he's in the office, and then after that he finds me in the meetings, and he conducts himself like he's like a baby genius almost, and that kind of translates to I don't yell at him, so now he likes to look at me and make deals because he sees me in meetings. So now he think he can close a deal. And like when I'm on the panel now, he say, "Dad, let me go down to my granny house while you do your work. Is that a deal?" And it's like, yeah, go ahead, do what you do. But the good thing is that he's 5, so I don't really have to get into depth with things, but I can keep him optimistic and keep him. And I tell him that the older that you're getting better, man. Just get better, and it'll get better with time. So that's pretty much where we're at with it.
Thank you both, and I really look forward to seeing you back in Muskegon again sometime soon. Thank you.